Hello. What are the complications after liposuction surgery? Can death happen after liposuction surgery? These are some of the questions we've been getting recently because of certain reports in the media. And we have had a lot of people ask us to make a video on this. So that is why today I'm Dr Aniketh Venkataram from the Venkat Center for Skin, ENT and Plastic Surgery. And we will discuss about the complications of liposuction surgery and whether death can happen after liposuction. Now, to begin with, liposuction is the most common cosmetic surgery done worldwide in both genders. In men, it is hair transplant. Liposuction is number 2. In women, liposuction is number 1. There are hundreds of thousands of cases done yearly. Obviously, this number wouldn't be happening if this was a very dangerous or risky surgery. If there are a lot of people dying from this surgery, you would not have so many people undergoing this surgery. So at the outset, I would like to say that liposuction is a very, very safe procedure. However, why are we talking about this? Recently, there was a death from liposuction which got covered a lot in the media, and that has made people feel scared. They're wondering. Media, as it does, has exaggerated some things and gotten some things wrong. So which is why people are understandably a little bit anxious and they want a little bit more information. Now, I don't know the specifics of that particular case, so we're not going to discuss that case in particular. We're going to have a general talk about what the possible complications are after liposuction. Because while liposuction is a safe surgery, it is a surgery. And any surgical procedure does have certain risks and complications. What are they? Let us talk about it. Now, before we talk about complications of liposuction, what is liposuction? Liposuction is pretty much what it sounds like. It is suction of fat. So in the body, you have the skin, you have the fat layer, you have muscle, then you have internal organs with internal fat. In liposuction, we make some small holes in the skin and we suck out the fat just below the skin. We don't do anything for the deeper fat. So this is a body shaping surgery. It is not a weight loss surgery. The aim of this surgery is not to lose 10-15 kilos. The aim of this surgery is to give you a better figure, remove that stubborn fat which is difficult to remove, and improve your self-confidence, which can then help you exercise and work out and reduce more fat. That is the aim of liposuction surgery. To know more about liposuction surgery, you can see our other videos on liposuction. Now let us talk about what are the possible complications of this surgery. Now, I would like to start off by classifying complications after liposuction into 2 categories. One is those complications which can happen after any surgery, not just liposuction. Second are the complications that are specific to liposuction alone. Firstly, what are the complications that can happen after any surgery? Well, one of the worst things that can happen is if an infection happens. Infection is possible with any surgery anywhere in the body, from the head to the toe. But the chance of this happening is very, very low. To prevent this, we sterilize our instruments, we use antibiotics. So with all this, the chance of it happening is extremely low, but it is not zero. It's something like every time you might be crossing a road, you might be hit by a car. It's something like that. The other thing which can happen is something called bleeding or hematoma. This is when there is a collection of blood somewhere after an operation. Again, chance of it happening is very low, but not zero. Then you have certain common complications which will be there. One of which is swelling. Swelling will be there after liposuction surgery. It will take a few days to go away. Second is bruising. Bruising is like reddish marks that happen on the skin. These vary based on the patient. Some people get a lot of bruising, some people hardly get any bruising. This is temporary. It will go away within a couple of weeks. Third is the area feeling a little bit numb. This can again happen, but this recovers. It takes a few weeks for it to happen. So these are some of the common complications that can happen after any surgery. Now let us look at some of the more rare complications. Here again we have complications that are more related to the general anesthesia. These include DVT or deep vein thrombosis or blood clots happening in the legs. This happens when a patient is lying down for a long period of time and isn't moving around. Another thing which can happen is fluid imbalance. When a lot of IV fluids are given and not enough is removed outside, so a lot of fluid builds up in the body. Again, this is more a general anesthesia thing. It doesn't happen under local anesthesia. We'll talk about that a little bit later in the video. Other rare complications are things like allergic reactions. Your body can have an allergic reaction to any medicine, But the chance of this happening is extremely rare. It is like 1 in a million. And it's not unique to medicines. Your body can have an allergic reaction to anything that you don't know of. So the chance of this happening is extremely minor. Lastly, there are complications which can happen because of the patient's condition. These include like a heart attack happening on the operating table. These include stuff like respiratory issues. This happens when the patient has other medical conditions or other illnesses in the body that have not been controlled fully. Liposuction being a cosmetic surgery, there's no reason to do it with any kind of risk. So the patient has to be evaluated properly. All these things have to be checked. And if any issues are found, they have to be treated and controlled before the surgery is done. So those are the complications that can happen after any surgery. Now let us talk about what are the complications that can happen after liposuction specifically. The first of this is called internal perforation. So you have the skin, you have the fat layer, you have the muscle, and then you have the internal organs. During liposuction, we're removing the fat that is just below the skin layer. Something which can happen is if instead of removing just the fat, your cannula goes deep and you damage an internal organ. This should not happen. This can happen if you get operated by someone who does not know what they're doing or who is inexperienced. So you need to make sure that you get this procedure done by someone who is well versed with what they're doing. This complication is also much lower under local anesthesia. Again, we will talk about that later on in the video. The other complication that's specific to liposuction is something called fat embolism. This is where a piece of fat goes into a blood vessel. And when it goes into a blood vessel, it can travel in the blood vessel, reach places like the heart and stuff, and this can cause serious complications. Now this again can be minimized if you're doing things safely. Some of it includes using of medicines to close the blood vessels so that they're not open, using proper cannulas, using proper technique. So the chance of this happening is very low, provided you get this surgery done by someone who knows what they are doing. Now we have spoken about all the complications. But does that mean that liposuction is not safe? No. These are all the possible complications. That doesn't mean they are probable. These complications can be eliminated if you take care of yourself and you do things safely. How can you be safe while doing a liposuction surgery? Firstly, the patient has to be evaluated before surgery and be made sure that any medical conditions are eliminated or controlled. This means things like BP, diabetes, thyroid. This should all be checked, and if there's any issue, it should be brought under control. Secondly, the surgery should be done in a proper place. It should be a proper operating room with sterile conditions with all emergency backup. If this is done, then the safety of the surgery is increased. Thirdly, the procedure should be done by someone who is trained and knows what they are doing. It should be done by a plastic surgeon. This means a DNB or an MCHN plastic surgery. You need to check for this. Secondly, make sure that your plastic surgeon has experience in liposuction specifically and see how long they've been doing liposuction. The next thing is the surgery itself should be done in a safe manner. What does this mean? The surgery should not be very aggressive. If needed, it should be staged, and proper cannulas and instruments should be used, and nothing should be done in excess. Safety should not be compromised in the aim of getting a more aggressive result. Safety should always come first. Lastly, the thing that we do is we do the surgery under local anesthesia instead of general anesthesia. This again improves the safety of the surgery. How? Firstly, it eliminates complications such as deep vein thrombosis, fluid imbalances, because the patient is awake. Patient can stand up in the middle of the surgery. Patient can go to the bathroom. So these complications are eliminated. Secondly, the chance of any internal damage that I mentioned earlier is much lower. This is because in local anesthesia, only the skin and the fat layer is anesthetized. The muscle layer below is not anesthetized. So if the cannula even touches the muscle by mistake, it contracts. It doesn't allow the cannula to go deeper. This eliminates the chance of an internal injury. So local anesthesia is the safest way to do this surgery. So why isn't all liposuction done under local anesthesia? This is because the trade-off for the safety is that there's a limit to how much can be done in one session. Full body lipo, 360 lipo cannot be done under local anesthesia because there's a limit to how much anesthesia can be given. So the larger areas have to be done in sessions. It cannot be done in one day. It might require 2 or 3 sessions. So these are some of the ways that you can be safe with the liposuction surgery. Now, having said all this, what is the bottom line? Is liposuction safe? Can you go ahead with it? To understand this, in any cosmetic surgery, we look at two things. We look at the risks and we look at the benefits. Surgery should be done when the benefits are high and the risks are low. If the risks are high and the benefits are low, then the surgery should not be done. Liposuction is a very, very safe surgery. The benefits are very high. You can have a much better body, much better self-confidence. The risks are very, very low. But they are not zero. You need to understand that this is a surgical procedure, so it should be treated with respect. It should be done in a proper place by a proper person after proper optimizing of the patient. When this is done, it is a very low risk surgery with very high benefits. Which is why, as I started with, this is the most common cosmetic surgery in the world because it is very, very safe and it gives good results. I hope this video was informative for you. If you have any questions, do let us know. Do like, share and subscribe to our channel. Thank you. Have a good day.